things spread. So as you can see on the title, that includes all manner of things that will move from place to place. And the idea of the talk is I just want to give you an idea of what a mathematician does as a job, show you some of the maths that we use to do that job, and hopefully give you an idea of, at the end of the day, how some very basic, simple principles can be used to do some really interesting and exciting things. So over the last year, there's of course been one thing that is spreading that we want to keep a really close eye on and learn a lot about, and that is, of course, COVID-19. And so for the last year, I've been working as part of a team of people to monitor the spread of COVID-19 throughout the UK and to try and get an idea of what might happen next, that we can advise the government on what could be happening. So we've been making lots of graphs that look like this. So this is a graph we made in sometime around August time, where on the left here, with all these grey diamonds, we had all the cases of hospital admissions that are happening every day. And we were tracking how many there were. And when we get to a certain point, we take all those diamonds up to that point, and using some of the maths, which I'm going to talk to you about now, we can start to make some best case scenarios, some worst case scenarios, and some somewhere in between scenarios as well to get an idea of what might be happening. So the name for this type of maths in general is called transmission dynamics. And as with a lot of things in maths, they like to make it sound a lot more complicated than it really is. So to break that down, transmission literally means something going from one place to another, if you transmit a signal, for example. And dynamics means how something changes over time. So we're interested in how things go from one place to another and how that changes over time. And despite the very fancy and impressive sounding name, all it is at the end of the day is just fancy counting, right? And to give you an idea of what I mean by that, it means that we're just keeping a list of a track of categories that we're interested in, and we're counting how many times it happens. So, for example, a category of people that we're very interested in monitoring during COVID-19 is number of infected people, right? Because you may have seen images like this before. What can happen, especially early on in an outbreak, things can rapidly increase. The number of people getting infected gets more and more and more each day, because starting from one person, they might infect two people, who then might infect two more people, who then might infect two more people, and it ends up increasing rapidly. So to get an idea of what's happening and what might happen next, that fancy counting I'm talking about, we're going to keep track of how many infected people there are and how many healthy people there are. So let's just imagine an example. We had a brand new disease. I know it's not anything that any of us want to think about right now, but just humor me for now. So let's say we know that there are currently 2 infected people and that we have 67 million other healthy people. So with lots of good testing and having an idea of how many new cases there might be, we might see that in the next day, there are 3 new infections. So we say, right, okay, let's -3. We're going to move 3 out of our healthy category, and we're going to add those 3 to our infected category instead. Then the next day, we might see more infections. Oh, now there's been 6 new infections. So we -6 from the healthy category, and we're going to add 6 to the infected category. And the next day, maybe we'll see even more infections, right? So we've got a -9 now, of 9 new infections from the healthy, and add that to the 9, add that to the number of infected people, and so on and so on, right? We're just keeping track of how many people are in each category. So that's all well and good as to seeing what's happening at the present time. So how do we look forward? How do we try and make a guess about what might happen next? Well, that's the mathematical rule I'm going to talk about here. So we ask ourselves as mathematicians, what is the probability of someone becoming infected, right? What increases or decreases the chances or odds of you being infected? Well, there's 2 important things that are going to impact that. One, it depends on how many infected people that you meet. If you are encountering more people, that's going to increase the risk of you getting infected. And also it depends on how infectious the virus itself is. So different diseases are either better or worse at spreading. Colds are really good at spreading very quickly, and sometimes other more serious ones can be quite limited in how quickly they spread. So that's the two main factors that we need to know to get an idea of what might happen next. So combining those 2 ideas together, we get one nice and easy equation. We're going to say, okay, our guess is the number of new cases we'll see on the next day is going to depend on how many infected people there are, and we're going to multiply that number by some number of how infectious the disease is, some infectiousness, right? And if you've been following any of the news, you might have heard people talking about the R0 number. And this R0 number is just the number which means the infectiousness in some way. And all we need to do then is to take that equation and we see where we left off in our example, and we can calculate the number of new cases. So the number of new cases will be our number of infected people, that's 20. And the infectiousness, well, that can often be a lot of the hard work there. We'll have biologists that'll be looking at the disease in a lab. We'll have other people that are, trying to work out how people interact and how it spreads, maybe through the air or something. And also we can look at our previous days and see the intervals that was going up in the previous days to get an idea of what that infectiousness number is. So in this example, let's say that it's 1.2 is our infectiousness number. So we would multiply 20 by 1.2 to get 24. And then that would be our next guess. We could say, okay, we think that the next day there will be 24 new cases. And then we can carry that forward in time as many times as we want. We could then times 24 by 1.2 and so on and so on and so on. The trickiest part with doing that, of course, is that infectiousness number can change over time, right? So you have to keep really close eye on how that might change. As things get colder, our immune systems get a bit weaker, which might make that infectiousness number go up. And also people might be hanging out indoors together more often as well, trying to keep warm, which is also going to increase things as well. And that is the rule. That is our fancy counting. If that made some sense to you, then congratulations. You are now an epidemiologist. You understand how diseases spread. And the coolest thing about that rule is that it works for more than just diseases as well, which is what the title alluded to. So that idea of everything being due to these two factors here, the number of infected people and how infectious that disease is, well, we can use the exact same rule to look at how other things spread. Now, there's lots of things that we talk about spreading. While you might catch a disease, we can talk about a song being really catchy or an idea catching on. And so this rule just perfectly translates into something like the spread of the popularity of a song. Instead of asking, what's the probability of someone becoming ill, we can ask, what's the probability of someone hearing and downloading a song? And that's going to depend on how many people they interact with who have heard the song, pardon me. And it also depends in some way on how catchy the song itself is. Sorry. And this is exactly the sort of thing that people do. So what you're looking at here is a study. We've got two graphs where they were monitoring the catchiness of two different songs. On the left is a graph tracking the infectiousness, as it were, of Heartless by Kanye West. And on the right, there's a monitoring the catchiness of Bad Romance by Lady Gaga. And so what they did is they used the exact same maths I've just talked about to study diseases to work out how infectious, how catchy these songs are. So this R0 number here is that infectiousness number I was talking about earlier. So they found that Heartless by Kanye West had an infectiousness of roughly 2.2, meaning that for everyone that downloads it, that's going to cause, through them talking about it and playing it, that's going to have 2.2 new people download it. Obviously, you can't have 0.2 of a person, but it'll be the average across everyone. Whereas Bad Romance by Lady Gaga was far, far higher, and that was R0 of 13, meaning that for every one person that bought and listened to Bad Romance by Lady Gaga, that would cause 13 new people to hear and like and go and download that song. And whereas we as mathematicians in my field of diseases, we're trying to work out how to make sure that diseases can be as least catchy as possible. What can we do to keep something not infectious? The people that look at these graphs, people that are trying to sell songs and make records, they're looking at this saying, well, how do we make a song as catchy as possible? They're trying to go the other way, but using the same mathematical rules. And it goes on further still. So that's those same two rules again about how a disease spreads or how a song catches on. You can also use that to look at how animals spread across a landscape. So I used to work at the Department of Zoology just down the road from you guys in Oxford. And we had lots of people that looking at how animals moved about a landscape. And what you do is this time the category, instead of healthy and ill people, it'll be the number of tigers in each little individual parts of the jungle, say. And of course, what depends on how many tigers there'll be somewhere, keeping count of how many tigers, it'll depend on how many other tigers there are there, because you need multiple tigers together to make more baby tigers. But also tigers are quite solitary hunters, so they don't want to be too clustered together. And also it depends on how catchy, how enticing a part of the jungle might be by how many, I don't know, how much food there is for the tigers there, or something like that, or how easy it is to hide. And these same rules we find work really good at predicting how many tigers we might see in this part in future days or weeks. And similarly as well, people use the same rules in computer games as well. So if anyone's familiar with the game Left 4 Dead, I know I'm probably showing my age a bit now. It's a bit of an older game now, but it was a game where people worked together to go and fight zombies together, and they would spawn in lots of new zombies for people to fight. And the number of new zombies there might be on the next level depends on how many other zombies there are there at that time, because you don't have too many. And it also depends on how well the player is doing as well. If they're doing really well, then you need to make more to keep it challenging for the player. Each time it's just this simple one rule that determines how it works. So you might be thinking, well, okay, that all sounds very nice and easy. If that's the case, why do we need people to go to university for years and do all this study to do so? And that's because while the principle is very simple, we're just counting these, we often need to count a lot more than just these two categories, right? So although we're interested in the number of healthy people and the number of infected people, well, we're also very interested, for example, in how many people have recovered, how many people had it and then got better. We also need to keep track of how many people have had their vaccinations, because that's going to impact how many new infections we see. And then we might want to also separate that out by age. We want to get track of how many people have it who are at school, perhaps, how many people who are in the workplace, or how many people are in care homes. All these different categories we want to keep a specific count of, that we don't want to clump them all together. We want to keep a really specific count across all these areas. And of course, even if we take all these new categories, we then don't want to do that across the whole country. We want to look at specific locations. We want to know, for example, how many people are infected in London or infected in Oxfordshire, for example. And so you can see that rapidly, as we try to monitor more and more of these specific categories, it can get really hard to keep track of them all, right? So, for example, the actual model that we use to try and have a look at what might happen next in the pandemic, we use over 4,000 different categories to do this. And that's just impossible to do by paper and pen, right? By subtracting 3, adding 3. So a lot of what my job really ends up doing is programming computers and writing computer code to do all the sums for us to try and save time. And that basically sums it all up. You now know the rule behind how these things spread. And if any of that is interesting to you in any way, if you thought, that'd be any of these examples might be something that you'd be interested in learning more about, a really good way to keep on track and see all the cool new stuff that people are using these rules for, and seeing all the new science coming out there. There's a great website called Science Journal for Kids, where they take all the latest science and they just condense it down into a really simplified way. Although it's cool for kids as well, I often find myself looking at it if it's something that I'm not too specialized in as well, just to get a really good surface level summary. And you can see some of our work there as well, if you want, to see how we use these rules to actually come out with new scientific information. I forgot to set the timer, so I have no idea if I've either been talking far too long or talking not enough, but that's me done talking. I'll turn it over for some more questions now at this point.